Okay, so I'm here to talk about Refer to Pharmacy, which is an electronic referral tool to allow hospital pharmacy teams to refer patients directly to their community pharmacists for some sort of post-discharge follow-up. Now, our tagline is, get the best from your medicines and stay healthy at home, which is kind of medicines optimisation in lay speak. So why bother referring to community pharmacists in the first place? Well, first of all, we've got the new medicine service, which has been commissioned for nearly 3 years now. And last August, Nottingham University showed that it can improve adherence by 10%, so more people getting the best from the medicines. Also last August, Wales published data from their discharge medication review scheme, which is equivalent to a post-discharge MUR, which showed for every £1 invested in administering that sort of scheme, you get a threefold return on that investment through better utilisation of medicines and fewer unscheduled episodes of care in ED. And also just getting the right information to the community pharmacist at the right time stops daft things happening where wrong medicines are restarted after the patient's been in hospital or new ones aren't continued. So what is the problem? It's basically getting the right information to the community pharmacist at the right time. Now, there's several options to actually doing that. You can do what we currently do, which is to signpost the patient, give them a bit of paper and encourage them to take their discharge letter along to the community pharmacies. It doesn't work because patients don't get it. They go to the community pharmacist to get things dispensed, to buy medicines, but very rarely do they specifically go just for advice, which is what these services are about. You can phone a pharmacy, fax a pharmacy, try and get information to them, but generally the quality of information transferred is low. There's all sorts of information governance issues around faxes, and they fail. You can't read the information at the other side of it. So electronic referral offers a lot of potential benefits. 2 versions. You can have an e-form, but someone's got to sit and type all the information in that you need to transfer, or you can have a fully integrated service, which is what Refer to Pharmacy is. Now, the advantages of an integrated service is it's fast. Because it talks to the computers in the hospital, you can get all the information with regards to the patient in terms of the demography by just putting a single patient identifier in. We also send a copy of the electronic discharge letter, so the community pharmacist receives the same information the GP gets and the patient gets in paper form. So for that episode of care, they know exactly what's gone on with the patient, what follow-up they've got, and also what medicines they're currently on, what's changed and why. It's got to be secure because we're sending very sensitive information about the patient through the internet. And it's also got to be auditable, so we can see how many of what type of referrals have been sent and what sort of process outcomes we've actually had from doing that. It's got to allow two-way communication so that the community pharmacist can contact the hospital pharmacy team if they've got any queries in relation to a particular referral. And it's got to be adaptable, because it's great if it works in East Lancashire, but the whole concept of the thing is it can be spread to other health economies. So the actual software just needs integrating with trust systems so that the necessary bits of information can be attached and forwarded on. So how will it work? On the hospital ward, as pharmacists and technicians go around doing their normal daily job, they will naturally identify patients who are eligible for some sort of post-discharge follow-up. They've been started on an antiplatelet, anticoagulant, medicines for hypertension, diabetes, COPD, asthma, all the things which make the patient eligible for new medicine service, or they've had some change to the medication which needs some sort of further information sharing once they actually get home. Or they use blister packs, they're a care home resident, and you just want to let the community pharmacist know about those changes so they don't have accidental things restarting and stopping when the patient actually goes back. And what will happen is that they'll give them a bookmark, and you've hopefully got one of those on your table to take away with you, which is there's a little bit of a double utility to remind patients about the service. But they'll also show them a film. Now, I'm not going to show you that today because it's 6 minutes long, there's not enough time, but if you go to that web address, and it's also on the bookmark, you can watch a film which we've made, which will show on the patient's bedside telly, which explains a little bit about the problems of poor medicines adherence, what we're doing about it in hospital, but mainly it's a lot of people who've talking about the success of actually having a post-discharge MUR or a new medicine service. And it's an advert for community pharmacy services to get the patient to understand why we're making that referral. So what I'm going to show you now is a few screenshots from Refer to Pharmacy. So we log into it. Now, if the technology is working, you're going to see a short sequence of a screen capture of me actually making a referral to indicate how fast it is. Because it's really important from the hospital point of view, it's quick. If it's not quick, you will not get referrals made.
We're going to make a referral for a new medicine service for someone who's had an end-stage heart attack and has been started on, amongst other things, aspirin. So click new referral, scan or enter the patient's hospital number, and then we'll formally consent the patient. Then we're going to make a new referral, select new medicine service, antiplatelet, aspirin. You can free type extra information if you want. The patient has told us to use Baxenden pharmacy, so we'll find the pharmacy now. So we'll just type in Baxenden, and there it is. Confirm that, and we'll review the referral. Everything's fine, the referral's been made. This will be sent to the pharmacy automatically when the patient is discharged, along with a copy of the discharge letter.
So part of the fact I was talking over the top of that is actually it takes about 30 seconds to make a referral. The imponderable is how much the patient talks back to you in the course of that interaction, but that happens anyway, you know. So to show you a few screens, we've got a consent screen, which basically explains to the patient what we're attempting to do, and we've got some language options. So for locally, we've got about 6 different languages with that statement translated into it, so that if someone doesn't speak English, they can understand what we're trying to do. Then we've got a referral screen, which gives you we've got 6 different referral options. We've got new medicine service, MUR, information only if you're on a complex regimen, you want to tell the community pharmacist that you open capsules and split tablets rather than get specials or something like that. Blister pack, care home, and we've got a domiciliary team as well. We're going to use this system to make referrals to for patients who are housebound. And in the example I've got, we click new medicine service, which gives some drop-downs. I've picked aspirin COPD. You can free type information into the box if it's pertinent. You don't have to if you don't want to. And we've got to find a pharmacy function. Now, basically, you type in the name of the pharmacy the patient's told you that they go to, or if you've got a bottle with an address, postcode, telephone number on, any little snippet of the address, start typing in, it'll gradually narrow the list down from however many you've got in there to the pharmacy you're interested in. And you just select that. But sometimes patients will say, well, it's the one round the corner from my GP's. So we've got Google Maps on there. The blue spot is where the patient lives, the green pins are community pharmacies, so you can zoom in and navigate around and hopefully find the pharmacy the patient's actually talking about. When you click on that, we eventually, on release 2, we'll have a picture of the community pharmacy on there as well, so that you can show them, is that your pharmacy? Select that, and then you review the referral, and then you can send it. We'll also give the option of a text or email reminder to the patient, so when they go home, they can get a further sort of reminder that a referral's been made. We can refer them at any point in the hospital journey from admission through to discharge. It doesn't have to be at the bitter end, so you're not laying everything on them in one go. And that means it's less rush for the pharmacy team as well, and they've got more time to sort of think about and ask questions. But because there could be a couple of days between you referring them and them actually leaving the building, that text email reminder, if they want it, just reinforces the message we've already given to them. Now in the community pharmacy, what will actually happen is the referral doesn't leave the building until 2 states are true. One is the PAS system, the patient administration system, recognises the patient as being discharged, because we don't want to refer people who haven't actually left the building yet. And secondly, the discharge letter has got to be completed. If they've left and the discharge letter has not been completed, we'll get a message back saying that's the case. And we can then chase that up with the ward and get the discharge letter completed. Now that can happen now anyway, so this is a bit of a kind of a closing of a loophole for referred patients. The community pharmacy will receive notification that a referral has been sent to them either by fax, text or email or any combination thereof, whatever's right for them. And that just basically says, please log in to your end of refer to pharmacy and either accept or reject the referral that we've made to them. They don't know who it's for at that stage. It's completely anonymised. But when they log in, they get a list of anyone who's actively been referred to them or who they are working with and that they've got appointments for. And all they do is click on a particular patient and they get a little bit of demography. If it's a patient they recognise, they can accept it. If they don't recognise a patient, they've got the option to reject it. Now, some patients might be like new presentation NSTEMIs, and they don't regularly use a particular pharmacy. So if that's the case, we'd have put a little note to that effect to basically update the community pharmacist that's the case. If they accept it, they then can click on the link which gives them the discharge letter, and they can also use the system, if they wish, to record the appointment date and time. So they've got some kind of record that they've actually spoken to the patient, if it's for a new medicine service or an MUR. If it's for information only, where they're updating the PMR, they would just update the PMR and close the episode down. To close the episode, there's a drop-down option. So for new medicine service, you can say whether the patient went through the process, whether they're deceased, whether they're admitted to hospital. There's an outcome process they can put in there, and the same with an MUR. And that archives the referral once they've actually completed it. So the list they're working with is only the live or new received referrals. So it's been from conception to now, it's been a couple of years. So it's taken quite a long time to sort of get to where we are. We're not quite live. We're expecting to go live next month. We should have gone live a couple of months ago, but there's been a problem internally with our own IT system, whereby we can actually make referrals, but they're only on a test server, and we need an update to our discharge letter system on the live server in order to get a feed for the electronic discharge letter. So if I'd known about it a little while ago, we'd have done something about it then, but they only told me about it sort of too late to actually sort of get us live earlier. Our software developers are Webstar Health, and we have an agreement with My Trust whereby we'll be a reference site. So if anyone wants to see it in action, they can get in touch and come and see it. But they'll also buy some time from me. So if someone is interested in getting it and needs some kind of a non-IT view of how it actually needs to be done, who you need to speak to get it off the ground, then they will buy time from My Trust of my time to come and talk to you, to hopefully help spread that. And we're interested in anyone who wants to know more about it and where it goes to next, because my vision is that it should be everywhere. If someone comes out of hospital and they've had changes to the medicines that the community pharmacist needs to know about or needs to do something with the patient, then it should be natural that that happens. We've got Manchester University on board to do a service evaluation over the next 9 months or so into the outcomes of refer to pharmacy, so we can prove independently what the outcomes are, hopefully successful outcomes. So we'll look at readmissions rates. Has that made a difference? Because that's how I've kind of sold it to my organisation. The two CCGs and My Trust have paid the initial money to get the thing off the ground. Webstar's put an awful lot in as well, and their return on investment is licence fees from other sites as we spread around the country. The CPPE are putting a training package together which will launch shortly, which will help hospital pharmacy teams identify people who are eligible for referral, but also to help community pharmacy teams interpret and understand hospital discharge letters. They're very self-intuitive once you're used to them, but if you've never seen one before, then you need a little bit of guidance how to use that. And the Royal Pharmaceutical Society has also put together a toolkit which helps health economies first put a business case together as to why they need a referral system putting in place, and also how to deliver that, which came out last December and is available on the internet. Creating spread of the concept of referral is really important, because unless we start talking about it, it ain't going to happen. For Refer to Pharmacy, we've got Twitter and Facebook accounts which you can follow if you wish. At the moment, it's all about sort of get development to date, but once we go live, we want to get patient stories in there as well. But also, it's changing the sort of attitude and opinions of the profession. So we talked about the Medicines Optimisation dashboard this morning, and my opinion is there should be something on there for the hospitals. How many referrals have you made this month? So that, first of all, creates a bit of an environment to actually start looking at what referral systems we've got in place and how we're going to do them. And it's basically influencing the commissioners to actually think about commissioning a referral system that is slick and that works. So the next steps for us is really your potential advocates for referral systems. Ideally refer to pharmacy because it's my baby, and I want to see it spread. But if you want to know more, get in touch. we hopefully will go live next month, but just thinking of the lead times in terms of having conversations with the triumvirate of a hospital pharmacy lead, a CCG medicines management lead, and an LPC lead. There's a lot of stuff has to be discussed before you even start thinking about involving finance and IT departments. So the lead time from sort of idea to going live will probably be a few months. So we'll be up and running well before the next site. So anyone wanting to know more, please get in touch. My email's on the presentation, and I'm sure Tricia will make sure this presentation gets shared with all of you. Thank you.